Washington Journal continues.
Joining us this segment is Jayne O'Donnell. She is the consumer reporter at USA Today. Thanks for being with us this morning.
My pleasure.
So you've done some reporting that looks at the growing need for doctors. Tell us about that and why there's some kind of a shortage now.
There is a shortage now, and there's projected to be a much larger shortage in the next 10 years or so. There's expected to be about 50,000 too few primary care physicians. I mean, as anybody knows who has insurance these days, the networks of doctors actually is shrinking. But when you consider that Medicaid's being expanded in so many states, and just generally the aging population, there really is a shortage of the kinds of doctors we're all supposed to be going to now under the Affordable Care Act.
Now, explain to me, why is there, if there's a shortage of primary care doctors, is there also a similar shortage in specialists? And if not, why is it specifically this particular group of doctors?
Well, depending on where you live, there can be a real shortage of specialists, certainly in more rural areas. But if you can think about the kinds of doctors that get paid the best, the specialists often get paid much, much more than primary care doctors. They're right at the bottom, right above HIV specialists. So primary care is not a profession that a lot of doctors want to go into. So there's a lot of outcry that there needs to be more funding, and that there should have been more funding in the Affordable Care Act.
Looking at your story now, you report that the United States is expected to need 52,000 more primary care physicians by 2025, according to the study by the Robert Graham Center. That is a pretty massive number. Have you heard anything from the medical community or perhaps about how to close that gap?
Well, one of the things that they want done is that they say that there needs to be more funding for medical residencies. It's there's certain kind of funding that's specifically targeted at that. If you think about it, a hospital is going to want to give the money or direct that kind of money when they get the funding to the specialties that are going to bring in more money to the hospital. So they say there needs, the physician groups, the primary care physician groups say there needs to be more oversight on how that money's spent and more perhaps strings on where it goes.
Our guest is Jayne O'Donnell. She's a consumer reporter at USA Today. To join our conversation this morning for Democrats, the number is 202-585-3880. For Republicans, 202-585-3881. And Independents, 202-585-3882. Jayne, you mentioned earlier the Affordable Care Act. What is the role of that law playing into this shortage?
Well, one of the key goals, I mean, there are so many goals. The major goal, of course, to make us all healthier, but one of the problems, particularly among lower income people, is they don't visit a doctor regularly. They just kind of go, you know, it's just a last minute thing. Oh my God, I'm sick, I'm going to the emergency room. That's extremely costly. Your insurance company, your employer, if you have a job, they really want to cut down on that. The Affordable Care Act really wants to cut down on that because they end up, the federal government has to end up paying for a lot of that care. They have to subsidize that care. So if everyone went to primary care doctors for their annual physicals or just even when they're sick, but more importantly for preventative care, it would keep the cost of health care lower. So that's pretty much it. So we're trying to get everyone to go to a primary care doctor, and so many people don't have a primary care doctor. They think of the emergency room as their primary care doctor. So that's going to drive a lot of it. And the fact that so many people now, millions more people now have insurance, whether it's Medicaid or plans that they bought on the exchanges. So these people all need to find doctors, and if you're in a rural area or even in an urban area like we live in, it can be pretty hard to find.
Greensboro, North Carolina, Jimmy is on the line for Independence.
Yeah, I'm just, you know, I thought that this has been discussed earlier, I mean, years ago, that there was obviously going to be a nursing shortage and a doctor shortage. And, you know, now all of a sudden, you know, we're worrying about the next 10 or 15 years. What's the underlying reason as to why we haven't done more to get doctors, you know, people to go into medical doctors, become medical doctors, and nurses for that matter also? And what do they see as the future? I mean, you know, a lot of people are screaming about Obamacare and rationed health care. Well, even without the ACA, we're headed that way. So I'll take my answer off there.
Well, a couple things I'll address. Like so many things in Washington, it comes down to funding. It's not that things haven't been done. I guess it's a question if you're in the primary care industry or if you're in the medical industry, most people would argue there needs to be more money to entice these people to get into this. Another important issue that we haven't mentioned is that there's something called scope of practice. It's who can do what in the world of medicine, and in many states it's extremely restricted on what nurse practitioners can do, what physician assistants can do. Many of us are now finding that maybe in our doctor's offices they're offering nurse practitioners and to do some of the, as an alternative to do some of the things like perhaps a strep test or vaccinations. And many people, except perhaps the American Medical Association in many cases, say that that's probably okay for some of these more rudimentary things that a doctor does, and that we would save the doctors with so many years of training and schooling for the most serious cases. So those are the two big issues, and I think I'll leave the people that are more in the opinion business than I am. I'm a straight news reporter to address the other issues the caller brought up.
Again, our guest is Jayne O'Donnell of USA Today. To join the conversation, Democrats 202-585-3880, Republicans 202-585-3881, Independents 202-585-3882, and if you're in the medical community, 202-585-3883. College Park, Maryland, Warren's on the line, who's a Democrat and in the medical community.
Hello, how you doing? My question basically is the education system. I feel like the education system is the problem, and that's the reason why we don't have enough medical professionals. It takes too long to go to nursing school and to medical school. So I feel like there should be a system that is set up in which medical schools can just focus on, there should be schools that are just set up to focus on medicine and nursing, where they can accept more students into the schools and make it a little bit much more easy. We take too many unnecessary classes, and it costs too much, and it just discourages people from going through the entire maybe 4, 5, 6, 8-year programs. I mean, there should be something done about that, I think.
I'm so glad the caller brought that up, because that was actually one of the next things I was going to talk about, the cost that is. The cost is going up extremely fast, as it is for colleges anywhere. And anybody who's a parent or is thinking about putting their kid through school and is thinking about putting their kid through school or has a kid in school knows that. But also, and so it isn't. We're not necessarily talking about the money-grubbing professionals that only want to be plastic surgeons or orthopedic surgeons that want to make all the money. I mean, it's simply the basic fact of some of these doctors, such as one we talked to for our story, wind up with like $250,000 in student loans. So they have to pay them off, and it's going to be much easier if they go into a higher paying area of specialty. The second thing I would talk to, it's certainly not my position to address how many years of school a doctor should have, but it is important to note that nurse practitioners and physician assistants can go through far less schooling and perform many of the functions, especially in rural areas or urban areas where doctors aren't likely to want to practice as much.
Next caller is James in Oviedo, Florida, on the line for Independence.
Yes, this is James Murray. I'm Florida, and I'm thinking that a lot of money should be, a lot more emphasis should be put on research for the family doctors. It seems like all of the research has been into specialties.
So you mean the doctors should be doing more research, or more research should be done about the practice of family medicine?
I don't believe he's online any longer.
Well, I guess one could say there is a lot of research being done right now on how to get more doctors to do this. I think that there is plenty of research on what these doctors should be doing when they're doing it, and I think this is all being studied. There are so many. I'm fairly new to covering healthcare just since last fall, but I'm amazed how many groups there are out there doing research, and it's very heartening. I mean, there's so many seemingly intractable problems right now in healthcare, but there's an awful lot of research being done right now.
Can you talk at all about the impact of the rise in population on, or not impact of population on this issue of doctor shortages for primary care physicians?
Right. I mean, and that's the biggest chunk of it. It's just, you know, we are, this is a very fast-growing society we're in. That's the top. The second most biggest contributor to the shortfall is going to be just the aging population, the baby boom generation. So many of us are going to be in the next 10 to 15 years going to be hit in Medicare, and Medicare is a very costly system for the federal government to pay for, and it's just a fact of life. Older people go to the doctor more. They're going to need more of these primary care doctors. They're going to need more heart doctors. They're going to need all of those kind of doctors, but everyone needs to go to the doctor more often. But yeah, it's just simply, you know, whether it's people coming in from other countries or just more the baby boom generation has children having children. It's just going to be it's a population issue that primary care doctors are not prepared to address.
On the Democrats line, Dan in Pittsburgh, Pennsylvania, also a member of the medical community.
Yeah, hi, I'm a family physician. I've been practicing and teaching for 20 years, and I see the main problem is access to care. We need more primary care providers, and nurse practitioners and PAs are a good start, but the same economic realities face them. They have high debt. They go into specialties because specialties among them are reimbursed at a greater rate as well. Student debt is a huge issue in terms of choosing a specialty. I think medical schools should be free, and PA and nurse practitioner schools should be free, and that would encourage more people to go into primary care.
Boy, it's hard to imagine that that's going to happen, but it's certainly a good suggestion. I just with the amount of money that the Affordable Care Act, and I know we're going to talk in a little bit about Medicare fraud. I mean, the cost of health care is so high. I mean, it's about 18% of our economy. It's just hard to imagine that medical school is going to become free. I mean, if there are ways to incentivize schools for offering less expensive degrees, I think that would certainly happen more quickly than it being free.
If it is at all, how is the federal government addressing this issue?
Well, they are asking, of course, Congress isn't around right now, but they did ask for a fair amount more money in their budget with this past spring. So we'll see what happens with that. You know, they don't always get what they ask for, but they are asking for more money. They want more money for these residencies. There's money being asked for the National Health Service Corps, for primary care training, and just generally another commission called the National Healthcare Workforce Commission. So there are budget requests. There's a lot of things going on right now by the federal government. Of course, it is easy to criticize the federal government, and they did ask for money. But the critics that I talked to for my story say that they should have anticipated that they'd be asking so much more of the primary care workforce, that more should have been done to get more doctors into the system. Some of the funding is scheduled to expire next year. That's one of the big problems. So just as something that appeared successful in getting hundreds of doctors to graduate every year appears to be bearing fruit, there goes the money.
Is it clear from your reporting how likely that funding request is to be honored, or to get the amount of money that they're looking for to solve this?
It's hard to tell. I mean, there's so much animosity and political rhetoric around the Affordable Care Act right now. It's hard to say, and frankly kind of sad to think about what could happen to funding for things like this that are in the best interest of society.
Let's go to Ellijay, Georgia, where Joe is on the line for Republicans. You're on with Jayne O'Donnell of USA Today.
Yeah, thank you very much. I love C-SPAN. I've been calling the show for 35 years. I think the big thing wrong, a lot of doctors are dropping out of practicing medicine because of they can't make enough money under Obamacare. So what we're trying to do in Georgia, we're trying to send up, we got David Perdue, a great businessman, running for Senate, another great guy, Barry Loudermilk, running for Congress. I think you're going to have to get more business leaders up here that can help cut the cost of Obamacare, or either eliminate it, so that you're not having so many, you're having so many primary physicians. My primary physician told me he's thinking about quitting because they can't make enough money under Obamacare. So I'm we in Georgia working to send people up to Washington, like businessman David Perdue and businessman Barry Loudermilk, to try to, to get to get the government not to penalize people who are trying to make a living. The doctors, they worked for 11 years to go to school, and now they're. So I just like to ask Jayne, what do you think about that?
Well, I'm so glad you brought that up, because that is a very important point that I should have mentioned, frankly, that the Medicare reimbursements, what the doctors actually get when a Medicare patient shows up, are getting smaller. Medicaid is so small, as one doctor, a surgeon in a local hospital, told me when he was working in the emergency room shifts, which he doesn't do any longer. He refused it just because it was so offensive. It was such a small amount of money for a procedure. So yeah, I mean, you've got the high cost of primary care and the low reimbursements under Medicare and Medicaid especially, and you could see why so many doctors are dropping out. And I've written about scary things that are going on in cosmetic surgery, where a lot of doctors are leaving primary care or OBGYN, which has, of course, high medical malpractice costs, to going into these largely unregulated fields just to make money on the side, whether it's a liposuction and different kind of cosmetic surgery practices, which people will pay for out of pocket. So it's scary to think what will happen if the reimbursement stays so low.
Question from Twitter. Jim Buck writes, PCP, and I assume it means primary care physician, shortage is real. How would online medical practice affect shortage and costs?
I think he's referring to telemedicine, and I'm actually about to get started on a story looking into that quite a bit. That does show a lot of promise, particularly I think it's more when it comes to specialties. But there are a certain number of things that a doctor could do depending on the state laws, whether you have to actually see somebody in person. There's all sorts of laws relating to, whether they can prescribe without seeing somebody in person, or whether they can actually diagnose without seeing somebody in person. But if there at least was some sort of a medical provider in a rural area, and then they could conference somebody in or do some sort of online, whether telemedicine, however it's done, if someone could be somehow connected to the person without being there, that would certainly help address the shortage. So it's a very good point.
Online for Independence, Sandra in Shelbyville, Indiana.
Good morning.
Morning.
My comment is it's about the Medicare Advantage. I read an article this weekend where they were going to be cutting back $160 billion in benefits, and also thousands of doctors from the program. So it's not so much as the reimbursement as it is cutting back on the doctors. And two, about the emergency room, I was to see a specialist. I chose to come here in my hometown. It was going to take me 6 months to get in to see him, so I chose to go where he was. But people who cannot do that, I can see where they go to the emergency room if they have something that can't wait 6 months. That's my comment.
Yes, certainly. I mean, you make several good points there. That the networks, it's not just Medicare Advantage, the networks for everybody. A lot of the doctors are shrinking, and I talked to doctors as the Affordable Care Act, as the exchanges were selling insurance towards the end of last year. They didn't even know what networks they were in. So things are changing a lot with networks. You might have to wait a very long time. Frankly, though, sometimes emergency rooms, unless it's extremely dire, may not see you. May say, no, you have to go to a specialist, because they are increasingly not being reimbursed for things unless they are true emergencies. So there's going to be kind of there are stopgap measures in all places here to keep people from doing things that are considered costly and unnecessary.
Democrats line, Prudence in Dobbs Ferry, New York.
Hello. I'm a long-time listener, first-time caller. I just wonder, my dad was a doctor. I'm 88 years old, almost 88, and he was a doctor in the days when the last thing you ask is how you're going to pay. And now, of course, the first thing you're asked is how you're going to pay. But I do remember during World War II, and I can't remember what you call it, but nurses were given stipends and getting their education free because there was such a shortage of nurses. My brother was a doctor. I think also his training was shortened during the war so that he could get through medical school. That was during the Korean War, I think, quicker and become and he went into the Air Force to be a doctor there. So I think perhaps if doctors went through medical school and were promised and did work where they were needed very seriously, if they worked there for so many years, that their costs would be eliminated or certainly diminished. So that I think perhaps we would get doctors who were really doctors and not out to make money. It's become a business, and I think that's kind of sad.
Well, it is sad, but it is, as some doctors tell me, it's simply a fact of life. I mean, it's very difficult if they're telling the truth, and I think at least some of them are, if not, some may be exaggerating, but it can be very difficult to run a medical practice when you have the cost of malpractice insurance and paying a staff and the so many other attendant costs that when reimbursements are so low, they do have to do things such as the caller alluded to is, talk up front about what are you going to be able to pay. I mean, these days with such high co-payments and such high deductibles, a lot of the doctors have to frankly ask before they even see the patient. I don't mean the doctor, but the people in the front desk have to ask, whether they have the money and to ask for the money to satisfy the deductible, because otherwise they're going to end up with so many unpaid bills that they could go out of business. So I certainly see the caller's point, but it does sound like there are certainly very high costs on the other end too for these doctors.
Now, from your reporting, were there specific areas of the country or types of areas where this primary care doctor shortage is felt more acutely than others?
Well, it's in the more rural areas, or certainly states like Utah or Oklahoma. Those kinds of states can have really big problems. I was in eastern Kentucky a few months ago. Like so many reporters, we've all gone to Kentucky because there are such incredible health care problems and other problems, frankly, unemployment. But in the area of eastern Kentucky I was in, there was actually pretty good access to care. But there are parts of the state where it can be very difficult to find primary care doctors. Fortunately, there are a lot of federally qualified health clinics, health centers around the country. But it can be an urban area. I mean, I reported right at the beginning of the rollout of the exchanges in September and October out of Philadelphia, and there were parts of Philadelphia where it may not seem like a long distance, but if you don't have a car and mass transportation and several kids, it can be very difficult to get across town to see a doctor. So it can be rural or it can be urban.
Next up in Holbert, Oklahoma, Jack's on the line for Independence and also a member of the medical community.
Good morning, ma'am. Yes, my wife is also a registered nurse. I'm a former paramedic, and I was accepted to medical school and declined in acceptance to medical school. Largely, the reason I declined in acceptance to medical school was because of the cost of tuition. But in recent years, I've considered going back and going to medical school, and one of the reasons I won't is because of the horrors that my wife experiences on a daily basis dealing with baby boomers and drug addicts. That is a large reason you cannot get people to stay or come into the profession. They are demanding. They think my wife is a maid, and they think their physicians are their licensed drug dealers. That's all they want. They complain constantly, nonstop. And you know what? Part of the problem in this country is we've lost our will to just deal with things. People go to the emergency room. I've worked both in pre-hospital care and in a level 1 trauma center, and people have lost their ability to just deal with it. The little things. My dad is the worst. He will go to the doctor for anything. If he has a snotty nose, if he pricks his finger, if he has a paper cut, he has to run to the doctor. I, on the other hand, got bit by a copperhead and walked back to the house and called my buddy, who's also a paramedic, and said, hey, if I don't call back in 15 minutes, you might want to go ahead and call an ambulance. Most people would drop a helicopter in fear to save their life. It turned out to be a drive-by. Move on. One of the biggest problems is we've just lost our ability to be strong in this country, and I blame that wholeheartedly on a generation of people who did nothing but smoke pot, party, and have wild, crazy stuff.
What do you really think? Okay, a couple things in there. I hope your dad isn't listening, number one. Number two, but maybe you've already told him this. You make some very good points, but frankly, the Affordable Care Act addressed many of your points. We're paying more out of pocket for our health care. So those of us who choose to go to the doctor, I tend to be one of those people who waits too long to go to the doctor, and I end up, it ends. I could have nipped in the bud sooner. So I mean, it can go both ways. But when we have to all pay a copay when we show up, and we're going to have to pay a percentage of visits that aren't for preventive care, so that aren't our physicals, but are because we had the sniffles or potentially the flu. Or those of us there are people that go to the emergency room when they think they might have the flu. I mean, that's what they really want to cut back on, because it does cost so much money. He made it in the caller made the comments in very strong terms, but there are a lot of good points in there, and of course the problems and the costs of people that are either drug addicts that are looking for prescription drugs to satisfy a habit, or the cost of just caring for people whose health care is so bad because they've been addicted to drugs are very, very huge drivers of the cost of health care right now.
Jayne O'Donnell, I want to ask you about a story that you have on the cover of this morning's USA Today. The headline is "Feds Push Electronic Records That Make Fraud Easier." Tell us all about it.
Well, one of the things that the Affordable Care Act is trying to do is to try to have the medical community coordinate care for you and I when we go to different doctors. The goal would be that all of our records would be available electronic. So if we were on vacation next week at the beach, that doctor could see what prescriptions we're on to address some of the caller's issues. We wouldn't be able to, not that we would ever do it, but others wouldn't be able to just go to a number of get a number of pain pills from different doctors. Of course, that's largely been addressed. But so electronic records will keep us from having the same tests done. It'll make sure we don't have prescriptions being filled that might conflict. Unfortunately, however, it makes it easier to commit fraud, and Medicare fraud is just huge. I've been researching this issue for the last few months, and there's a big story that might be in this week, hopefully tomorrow, on Medicare fraud. And these guys, guys and women, I'm sure there must be women out there doing it, if the records are electronic, they can frequently make changes. They can make changes like cut and paste, like we all do in documents these days, and put something for one patient into a document that for a future patient that perhaps doesn't even exist, or to say there's a treatment that doesn't happen. It actually facilitates it. So there's right now an audit function that should be on all these kinds of records when hospitals use them. These hospitals and doctors are being greatly incentivized to use them. About $22 billion is being spent to get them to use these because of the great health benefit. But there isn't enough being done, according to critics and fraud experts, that by not requiring this audit function to be on so that it's easy to tell where records might have been fabricated, it really becomes something that we're paying a lot for on both ends.
Next up, in Fort Lee, New Jersey, Harvey is on the line. He is an independent as well as in the medical community.
Good morning, and thank you for C-SPAN. I've had 35 years of graduate teaching as well as years as an administrator with the largest public hospital system in the United States, and they are super, the New York City Health and Hospital Corporation. Perhaps we should increase the cost of health care, increase reimbursement, make sure there are training programs for doctors are the best in the world. Make sure that at each level of care, all of these doctors have the best professors. A surgeon many years ago told me, Harvey, I could make you a super surgeon, and you'll be able to take out an appendix as good as any of us, The question is, will you know when to take it out? And that's the training. We're trying to seek all different levels of pseudo-physicians. I'm not against nurse practitioners, physician's assistants, but what you're doing is filtering down the quality. Every patient is custom designed. People must understand that.
Your thoughts?
Well, there's a couple of good points in there. I think any doctor listening would certainly agree that medical reimbursements, it would be nice if they went up. I can't imagine that happening too soon until we can get the cost of health care overall, some of the problems addressed, such as more people seeking and getting preventative care, so that we're not having to spend so much money on the emergency room side. Certainly the training of doctors should continue to be an area of focus. It is something that the Obama administration is asking for more funding in that area. But I don't think we're going to see more money going to pay doctors until we can get some other money out of the healthcare expenditures. And maybe according to the fraud experts I talked to today, maybe if we could get some of the money out of fraud. Just there's so much. It's really offensive when you think of it as a taxpayer. How much money is going to people that aren't even performing the services or could be complete con artists, frankly.
Our guest is Jayne O'Donnell of USA Today. For Democrats, the number is 202-585-3880. For Republicans, 202-585-3881. For Independents, 202-585-3882. And for members of the medical community, 202-585-3883. Next up is Paul in Rome, Georgia, on the line for Independents. Hey, Paul, are you with us?
Yes.
Go right ahead. You're on with Jayne O'Donnell of USA Today.
Yes, I've been disabled for about 6 years, and the doctors are really having a hard time trying to figure out. I got so many problems and medical conditions trying to figure out exactly what's wrong with me and how can they fix it. And at the same time, I got a wife and 4 kids, and I understand Obamacare can tax you for not having any medical, I'm not sure what I'm trying to say, but I got Medicare and Medicaid, but my wife, I'm really concerned about my wife. She's got a lot of problems, and I'm wondering what if she's got cancer or whatever. She's got back problems. She's had knee surgery in the past. And I feel like that because I'm getting the help and she's not. I feel like that. I don't know. I feel like I should do more, and I'm not able to do more.
Well, I would certainly hope. It sounds like the caller he mentions Medicare and Medicaid, so he's getting disability. As far as his wife, she should, if she is not working, she should be able to buy a plan on the exchange, or if she's not working, excuse me, if they are not making enough money for her to pay for a plan, and she's not eligible for Medicaid, I don't believe Georgia expanded Medicaid, then she should be able to find a health clinic somewhere in her area to get the necessary testing done. I mean, there's certainly, up until the Affordable Care Act, people like the caller's wife could get health care, it would typically be on a sliding scale at these federally qualified health centers. So she should have the testing done. Of course, it's hard to tell from the caller whether was some indication that there's cancer or whether she had it and it may have come back. But the necessary testing should be done at a federally qualified health center, and the caller should probably focus on himself and make sure that his children are getting the Medicaid program called CHIP, because that is available to children in every state.
McLean, Virginia. Ben's on the line for Democrats.
Thank you very much. I appreciate, Ms. O'Donnell, your responses to the many questions touching on cost and debt and some of the other difficult issues in the system, and the difficulty of implementing changes such as, for example, changing the structure of medical school fees. But I'd like to ask you to go a little bit deeper into the issue of allocation of funds and incentives. If you're paying primary care physicians much less, that is, when they go out, you're going to have fewer people going into the primary care area. And if you're paying for the cost of specialists for their education, that's an extra incentive for people to go into specializations so that they can pay off their very large debts incurred in medical school. It seems to me that one thing that could be done, and I don't say that is that the reimbursements or the payments for different types of training be reversed, that some more money go into paying for some of the costs of the first 3 or 4 years of education for doctors, and that people who decide to go into specializations be required to pick up some of the costs there. And especially if they're getting their primary education for less money, or perhaps eventually for free, although that's an ideal that probably won't be attained, they would be able to afford to pay more for the specialization. Could you address the incentive structure as it exists now and how it might be revised?
Well, it sounds like the caller knows it pretty well, and probably better than I do. This is not my area of expertise, but from what we learned doing this story last week, is that clearly there aren't enough incentives, and there is too much incentive for hospitals to devote their residency dollars towards those higher paying specialties. It's so difficult. There's so many good ideas out there, and the caller touches on several of them, but getting them passed, the medical lobby is a very powerful one, and the specialists probably have, the bulk of that lobbying clout. I agree. It sounds perfectly reasonable what the caller's talking about, but I'm actually not in a position to really say my opinion as much as to say that what you're talking about is certainly something that the primary care trade associations would agree with.
Let's go to Litchfield, New Hampshire, where Ray is on the line for Republicans.
Hi, thanks for taking my call today. I have a couple questions. First thing is, I see a lot of articles about how in Massachusetts, they've had Romney Care now for quite a while, and they're still seeing an increase in the number of people using emergency rooms instead of a primary care physician for things like, the sniffles or the flu or things like that, non-emergencies. Even though, is it because they don't have enough primary care physicians? I've never been able to read why they've seen this increase, just that people have insurance now and they're just using the emergency room. The other thing is, like here in New Hampshire, I'm seeing a lot of small urgent care facilities opening up, being affiliated with local hospitals or doctors groups, and you're seeing articles about how the major drugstores, Walgreens, CVS, are looking at having small, little urgent care facilities for the flu, what have you. You can take your kids; they're sick. Where it would be more of a nurse practitioner as opposed to a doctor. And I don't know if you've looked into that. And last question is, with the expansion of Medicaid, is there a deductible or a copay associated with that program?
Yeah, people can't. People often will have to pay something, but not always when it comes to Medicaid. But what you bring up, the alternatives for, or when it comes to urgent care facilities or CVS or the drugstore, whatever it is, the key is to get people out of emergency rooms. And yes, I've seen the same studies that the caller has about emergency room visits going up. And yeah, yes, certainly one of the reasons cited, or some of the speculation, is that just more people have insurance. So some of the people I talked to in Kentucky, I mean, the guys would frankly laugh because they were supposed to be such tough coal miners that they didn't go unless a limb was falling off. But they had nothing but time. A lot of them were laid off or had simply been out of work for a long time, or perhaps like the previous caller's father probably retired. So we're going to the doctor a lot. So when you have people that aren't working and that suddenly do have access to care, yes, they do go to the doctor more often. The key is trying to get them to somebody who is a less expensive provider, and sometimes that is going to be the person who might be a nurse practitioner. I think the picture online with my story today shows a nurse practitioner at a CVS providing care. I mean, that is less expensive, and so many, you do want people to be treated or get the right care if they do have a communicable illness like the flu or strep throat. So just don't have them show up at the emergency room.
All right. Our guest is Jayne O'Donnell, consumer reporter of USA Today. Thank you so much for being with us this morning.
My pleasure.
Next, our weekly Your Money segment continues with a look at the Export-Import Bank and the debate over whether or not Congress should reauthorize it. But now let's go to C-SPAN Radio for a news update.
It's 9:15 a.m. Eastern Time. Some international news this hour. The Associated Press reports that there is a July 20th target date for a deal over Iran's nuclear program, but diplomats say talks in Vienna are making little headway. Two diplomats telling the Associated Press that there's still disagreement on the constraints Iran would have to accept in exchange for a full end to sanctions that have been stifling its economy. Well, Washington State has issued its first retail marijuana licenses today. This means the first stores will be allowed to conduct business as of tomorrow at 8 a.m. And John Evich, an investor in Bellingham's Top Shelf Cannabis, says, quote, "We're pretty stoked." The issuing of retail licenses comes after Washington and Colorado voted in November of 2012 to legalize marijuana for adults over 21. And the Education Department is announcing a new initiative to attract quality teachers to the schools that need them the most. It comes the same day the president meets with teachers at the White House. The Education Department data shows that Black and American Indian students are 4 times as likely as their white peers to go to a school where more than 20% of teachers are in their first year. Latino students are 3 times as likely. The department says it will ask states to come up with new and comprehensive educator equity plans. C-SPAN will cover any remarks from the president at his meeting today at the White House. And those are some of the latest headlines on C-SPAN Radio.
The internet content, I think we would all agree, should remain